Part A and B sound like they do the same thing. They don't. And the difference between them has cost people I've worked with tens of thousands of dollars. Not because they picked the wrong one, but because they assumed the wrong one covered something it doesn't. Here's the thing that messes people up. Part A covers you in the hospital, and Part B covers you at the doctor. Simple, right? Except it's not. Because there are situations where you're in the hospital and Part A doesn't cover you. You're physically in a bed, and it's Part B paying the bill. And if you don't have Part B, or your Part B coverage has gaps, that bill lands right in your lap. I'm Andy Childs. I've been a Medicare broker since I was 20. And over the course of this video, I'm going to show you exactly what Part A covers and exactly what Part B covers. The gray zone in the middle and where people lose money. And the one enrollment deadline that carries a penalty for life. Before we get into the coverage lists, and I will give you a full breakdown, I need to explain something that changes how you'll hear everything I'm about to say. Most people think of Part A and Part B as two separate buckets. Hospital bucket, doctor bucket. And that's technically right, but the way Medicare actually decides which bucket pays is not based on where you are, it's based on your admission status. That distinction, admission status, is the single most expensive thing in Medicare that nobody explains to you up front. Because you can be in a hospital for 3 days and Medicare says you were actually never admitted. And that changes everything about what you pay. Keep that in mind at the back of your head. We'll get there. First, let me give you a clear breakdown so you know what each part is supposed to do. Here's why I'm making this video instead of just telling you to read the Medicare handbook. The handbook is 47 pages long. I've read it cover to cover more times than I can count. And even I think it buries the information that matters most under language that's designed to be technically accurate instead of actually helpful. I had a client, a retired teacher here in the East Valley, who told me she spent an entire weekend reading through Medicare.gov, trying to understand what Part A covered and what Part B covered. She made a chart, color-coded it, used highlighters, the whole thing. And she still didn't know that if her husband went into the hospital for observation, instead of being formally admitted, Part A wouldn't cover his stay. She didn't know that because Medicare.gov never says it in those words. It's buried in a section about inpatient versus outpatient. And it reads like it was written by a committee of lawyers. 3 months later, her husband had a fall. He was in the hospital for 2 nights, observation status. Part A didn't kick in, and the bill was over $8,000. She had the information, she did the work, and she still got caught. That's who this video is for. The people who are trying to get it right and deserve an explanation that matches how Medicare works. So let's do this properly. Part A is called hospital insurance, and that name is mostly accurate, but the word hospital is doing more work than you think. Here's what Part A covers. Inpatient hospital stays. If you're formally admitted to a hospital, and I'll explain what formally means in a second, Part A covers your room, meals, nursing care, medications you receive during the stay, and any procedures done while you're admitted. Skilled nursing facility care, if you need rehab or skilled nursing after hospital stay, not long-term care, that's different. Part A covers up to 100 days in a skilled nursing facility. The first 20 days are fully covered. Days 21 through 100 have a daily copay that in 2026 is over $200. Hospice care, Part A covers hospice services if you have a terminal illness and choose comfort care over the curative treatment. Home health care, Part A covers certain home health services if you're homebound and you need skilled nursing or therapy. Now here's the trap I mentioned. I had a gentleman, he lives here in Chandler, who went to the ER after chest pains. They kept him in the hospital for 2 days. They ran tests, they monitored him. He assumed he was admitted. His family assumed he was admitted. He was in a hospital room with a hospital bracelet, eating hospital food. But when the bill came, Medicare said he was under observation status. That means the hospital classified him as an outpatient, even though he never left the building. And under observation status, Part A doesn't pay, Part B does. And Part B covers it differently, with different copays, different cost sharing, and no coverage for the medications they gave him during the stay. He owed over $6,000. That's not an edge case. This happens constantly. The Medicare Payment Advisory Commission has reported that observation stays have dramatically increased over the past decade. Hospitals use observation status more and more because of how they get reimbursed. So here's what I'm going to tell you. If you or a family member is in a hospital and it's been more than 24 hours, ask the nurse or the admissions department one question. Am I admitted as an inpatient or am I under observation? That one question can save you thousands. If you're under observation and you believe you should be admitted, you have a right to request a formal review. So ask for it. Part A covers the big scary events, hospital stays, skilled nursing facilities, hospice. But Part B covers the stuff you use all the time. And ironically, it's the part people pay less attention to, even though it affects them more often. Here's what Part B covers. It's a long list. Doctor visits, any outpatient visit, your primary care, your specialist, urgent care. Preventative services, annual wellness, flu shots, mammograms, colonoscopies, cardiovascular, diabetes screenings. It covers this long list of preventative services at zero cost to you. No copay, no deductible. They're 100% covered if you go to a provider who accepts Medicare. Lab work and diagnostic tests, blood work, x-rays, MRIs, CT scans, it's all Part B. Durable medical equipment, wheelchairs, walkers, hospital beds, oxygen equipment. Part B covers those when prescribed by a doctor. Outpatient surgery, if you have a procedure done at an outpatient surgery center or a hospital outpatient department. Part B. Mental health services, therapy, psychiatric visits, substance abuse treatments, it's all Part B. And this is one of the most underused benefits in Medicare. Now here's a story that shows why Part B matters more than people realize. I had a woman, she was recently enrolled in Medicare, who told me she hadn't seen a doctor in 3 years. She hadn't seen it because she was worried about costs. She'd been on her husband's employer plan before he retired, and she assumed Medicare would work the same way, with surprise bills and confusing cost sharing. I walked her through her Part B preventative benefits, zero cost annual visits, zero cost mammogram, zero cost cardiovascular screening. She had no idea. She went in for a wellness visit, and they caught early stage high blood pressure, and she hadn't been monitoring that. They put her on a low-cost generic prescription, and her doctor told her that if she had waited another 2 years, she'd have been looking at medication with serious side effects and potentially a cardiac event. Part B didn't just save her money, it caught something that could have shortened her life, and it cost her nothing out of pocket for that visit. If you're on Medicare and you're not using your preventative benefits every year, you're leaving the most valuable of Part B on the table. Now, the deadline. I teased this at the end of my last video because it's the single most costly mistake I see, and it's the one with 0 second chances. Your initial enrollment period for Medicare is a 7-month window. It starts 3 months before you turn 65, includes your birthday month, and ends 3 months after you turn 65. During that window, you sign up for Part A and Part B. If you have Part A automatically, most people do through Social Security, you still need to actively enroll in Part B during this window, unless you have qualifying, and that's important, qualifying employer coverage. Let me give you 3 things to protect yourself. First, if you're approaching 65, enroll in Part B during your IEP, initial enrollment period, even if you feel healthy. The cost of the premium is nothing compared to a lifetime penalty. Second, if you're still working at 65 with employer-sponsored group coverage, not Marketplace, not COBRA, not individual coverage, but employer-sponsored group coverage, you may be able to delay Part B. I'd recommend getting a written confirmation from your HR department and keep that documentation. Third, if you're not sure whether your situation qualifies, talk to an independent broker before your enrollment window closes. Not the 1-800 number, not a Google search, but a real person who understands your specific circumstances. So let's bring it together. Part A, hospital insurance. It covers inpatient stays, skilled nursing facilities, hospice, and some home health care. The trap to watch for is the observation status, when you're in the hospital but not technically admitted. Part B, medical insurance. It covers doctor visits, preventative care, lab work, outpatient procedures, and durable medical equipment. The benefit most people underuse, free preventative services every year. And then last, the deadline. A 7-month window from your 65 birthday, and miss it without your qualifying employer coverage, and the penalty is permanent. So now you know what Part A and Part B cover. The next question, and it's the question that trips up more people than anything, is this. Do you go Medicare Advantage, where one plan handles everything, or do you stick with original Medicare and add a Medigap supplement? I've had clients pick Advantage and love it. I've had clients pick Supplement and love it. And the difference is one thing, and it's not what you think. So that's the next video, and I'll see you there.